So, hey guys, I hope all is well. Today we'll be presenting for Los Angeles for Human Immigration Rights, and we'll do so in a comparative way. We'll be comparing 4 cities, ranging from Chicago, LA, to New York, and then Denver. So we'll be starting by introducing ourselves. My name is Olivia, currently a junior at USC, majoring in international relations and global economy, and the city I did my research on was New York.
My name is North Brett. I'm a sophomore studying philosophy, politics, and law, and I also focus on New York along with Olivia.
My name is Alexa. I'm also a sophomore studying philosophy, politics, and law, and I focused on Chicago.
My name is Pavitra. I'm a sophomore studying political science, and I focused on Denver.
I'm Shiza. I'm a junior studying political science, and I focused on LA.
My name is Isai. I'm a senior at USC, majoring in law, history, and culture, and I also study Unruh.
Yeah, so we're very excited to present our final project to all of y'all in the room today. We'll be starting by presenting the research question. As mentioned, it's comparing approaches like sanctuary cities, such as Los Angeles, Denver, Chicago, and New York, in navigating migrant buses coming from Operation Lone Star, and how can we come up with better immigration integration policies that's for Humane Los Angeles. So we'll be doing our analysis through 4 pillars. The first one is healthcare, then education, employment, then with housing. So each of us will be presenting either 2 pillars of these 4 or the 4 pillars, depending on how many of us are researching for one city. So I'll be starting by contextualizing the problem. As mentioned, Operation Lone Star is an initiative that was launched in March 2021 by the state of Texas with its mission for securing the border between US and Mexico. However, beginning in spring 2022, the operation extended beyond its border as Texas began transporting undocumented migrants to other sanctuary cities by charter buses. So as seen here on the right side infographic, by date of February 10, 2025, $11 billion has been spent for the cost of Operation Lone Star, and about 600,000 of those are spent on transportation and related costs and services, which is a very significant amount of budget for the state of Texas, which could have used $30 million to provide free lunch and breakfast for school children for 2 years, or using $5 billion to fix the Texas power grid. So these are prominent sanctuary cities here in the US. For our focus, we'll be zooming on New York City, which has received over 43,000 undocumented migrants through Operation Lone Star, Chicago, which has received over 35,000, Denver, which has received over 18,000, and then landing on Los Angeles with 1,500 or so undocumented migrants received from Operation Lone Star. So before jumping to city-level analysis, I want to take the time and space to acknowledge that federal-level challenges still persist. So no matter what policy we're proposing for Los Angeles, there is no limitation from federal level. One of the most prominent one is related to employment assistance, which is the asylum plot. Now, as undocumented migrants usually come into US, and many of them seek asylum application, and they have to wait a minimum of 180 days before they can file for formal and legal employment authorization, otherwise known as the employment authorization document issued by the US Citizenship and Immigration Services. So this is a sample form that I'll have to fill out when applying for employment authorization. Other than the hardship associated with getting legal assistance and people trying to fill out these forms correctly, it also comes with a hefty application fee of $520, which is a very significant amount for people who are trying to settle in a new country. So now I'll be beginning city-level analysis, focusing on New York City on its healthcare and employment pillars. So before jumping to healthcare, insurance is a very interesting and important topic to mention. So immigrants in New York are lucky that they have relatively more insurance options that are available for them. And New York City also makes sure to provide an official guide in multiple languages on how to obtain those insurance and which one undocumented migrants are eligible for applying. So this is a sample guide from New York City Human Resources Administration, and as seen on the left corner over here, Guide to Health Insurance and Healthcare Services, specifically for immigrants in New York City. They also make sure to include a disclaimer whenever they're trying to provide a service guidance. So this ranges from health insurance to education to other service guides that are available on their website, that no matter how much resources or how you access the city services, your immigration status will not be affected, and it will be confidential and not reported to federal level agents. And they are also available in multiple languages, ranging from English to Chinese to Korean, Polish, which is a comprehensive coverage. And the other city can use this as a template to ensure more comprehensive approaches for people from different backgrounds. So now jumping into the actual healthcare programs in New York City, to streamline our analysis, we will all be beginning by introducing the areas of weakness, then jumping to strength to better propose policy in the end. So in terms of healthcare, even though New York is known as one of the sanctuary cities with the best healthcare program, one of the most prominent area of weakness is that they did not expand mental health services or ensure that people had access to it. On the infographic on the right was published by the New York City Mayor's Office, mentioning that New Yorkers without health insurance usually have a harder time to access mental health care. Since a lot of undocumented migrants do not have access to health insurance, this problem is definitely escalated among that community as well. And under New York City's public health program, mental health is usually provided through their program called Express Care, which refers to a 10 to 20 minutes phone call with a practitioner available. So the obvious downside of that is that mental health services are usually not intended to be long-term, or long-term access is not ensured for a lot of the undocumented migrants who are seeking help. And for a lot of undocumented migrants, mental health care is very important, as many are under stress and trauma related to their immigration status. And lastly, oftentimes mental health service does blend in with primary care, so that would be 2 questions, 4 questions, 3 questions asked during the primary intake for a lot of the undocumented migrants where they're visiting doctors for the first time. So jumping into area of strength, New York City had these 2 prominent aspects. The first one is known as the no wrong door policy, referring to New York City's attempt to create a one-stop for healthcare access for all citizens and undocumented migrants living within New York cities. And what that looks like is if I show up for a clinic today looking for gynecologist access, but they weren't able to provide the service I was looking, they will make sure to refer me or the patient themselves to another clinic, to another resource center that can provide useful information to access those services. So the second one, which is pretty unique to New York, is called New York City Care, which is a funded program that provides low-cost and no-cost services, especially for folks who cannot sign up for health insurance or who cannot pay for health insurance. And on the right side, this is a sample membership card from New York City Care. You can see the members, so the patient name will be listed on there, and the primary caregiver and their contact information. And there's also the copay / fee that's being specified on the front side of the program, of the card, sorry. And you can see the fee is minimal, with only pharmacy requiring a $2 copay for use. So as mentioned, New York City does have a pretty good healthcare engagement. So this graphic was published by New York City Care, and looking on the right side for ESL status, people who are under New York City Care do have a higher return rates to primary care and receiving referral or receiving multiple specialty care visit compared to other federal programs such as Medicaid. So this is very prominent, as we do want to provide undocumented migrants with access to health insurance and health care beyond emergency care, and also ensure that they can manage their long-term health goal more efficiently. So now moving on, we're moving into the employment pillar. As mentioned, starting with the areas of weakness, so New York City had limited legal assistance for a lot of asylum application seekers, primarily in the fact that they lack pro bono services with community partners such as immigration law firms who could have provided those services. So on the right side, you can see the advocacy movement of Make the Road New York, advocating for funding legal services and establishing a legal fund for a lot of the undocumented migrants who are seeking for legal support, especially asylum application. And there's also inefficient communication with other community partners, which is very important at the time when federal level challenges still persist. So a lot of times undocumented migrants cannot access legal or formal employment. At these times, informal cash payments, employments are very important. A lot of community partners do provide those opportunities. However, as pictured here is the New York Immigrant Coalition. They do kind of advocate the issue with communication with the city government of lack of platform or lack of reach for their resource and job fairs. And a lot of job fairs are sometimes only limited to geographic regions such as Manhattan, but neighborhoods such as Bronx and other boroughs such as Bronx and Queens, who host huge immigrant population do not really have access to these resources. However, on the plus side, there are areas of strength ranging from substance aid provided by New York City Mayor's Office for Economic Opportunity. So these aids are provided for necessity goods, and they're usually given out twice a month. And special assistance is available for populations such as women or children who are in need of access to, for example, textbook, other education resources, or formula/diapers. And the other rather unique program to New York City is called ID New York City, which is a program that you can sign up for a form of identification regardless of your immigration status. So compared to other IDs such as driver's license, sometimes you have to provide your residence, legal documentation to prove your status within the US. But this program is specifically designed that everybody can have a form of identification in New York City regardless of their immigration status, which provides an efficient way for a lot of undocumented migrants to access public resources such as museum, libraries, so subsequently ESL trainings or job trainings. And they also make sure to include those to gym membership or museum, art gallery access to better integrate undocumented migrants into the existing community. And lastly, New York City Mayor's Office of Immigrant Affairs did establish the Asylum Application Help Center. Those services was limited and more provided to family units. However, this was also in response specifically to the Operation Lone Star established in April of 2022. So now, after discussing healthcare and employment, I'll be handing over the discussion to Dor for housing and education.
Thank you. Oh, sorry. Okay, so I'll begin by discussing housing, and I want us to give some background about it. And so, Make the Road New York, the nonprofit that Olivia already mentioned, did a really comprehensive survey of over 500 asylum seekers that were present in New York after Operation Lone Star, which gave a really good overview of different data and demographics about them that I found really helpful. So as you can see here, mostly the immigrants of the over 46,000 that came were from countries including Venezuela, Guinea, and Ecuador and Colombia, although with Venezuela the trend was going down, so it's possible that in the future with LA, that trend will go down as well. And then also, the family breakdown-wise, most of the immigrants did come with families. However, there was like a marked difference by the race of the immigrants. So Latino people did tend to come with families of children under 21 way more often compared to Black people who more often travel as single individuals. And moreover, with all this influx of immigrants, New York ended up providing housing services to over 200,000 immigrants, which included both group and individual housing to accommodate the different family types. And so now I'll begin with the housing weaknesses. So the main weakness when it comes to housing was just inadequate contractors for the housing shelters that just didn't provide the services that they promised to provide or that immigrants needed. So the ones that were most problematic were the Acacia Network, CORE, and Canva, and those were found like across the board where either they had financial scandals or just consistent reports from immigrants of like not receiving what they needed at the shelters, like healthcare and security services. And as you can see in the graph there, some of the notable things that the immigrants tended to miss were not feeling safe or not having storage or even not having heat. And then also, the housing shelters that were built were often in remote locations. So I'll get into what housing shelters were created in the next slide, but one of them was a tent city, and it was on this island. And clearly, it's being an island, it's like far from other areas in the city and other services that immigrants might need to access. And moreover, New York had a intake rule where basically either for individuals it was after 30 days or for families it was after 60 days where they had to essentially reapply for housing. So as you can see, the majority of the immigrants had to reapply, which just makes it more difficult for them to build a stable life because they're constantly moving around from different shelters and aren't able to get access to stable housing. And then this reapplication also led to low turnover into permanent housing. So as you can see from this data as well, over 50% of them have lived in multiple shelters, but only 5% of them were able to find a housing option outside of these shelters. And now moving on to areas of strength, one thing that New York did really well was that it was able to mobilize quickly to create more housing options. I think part of that was because they already have a really present infrastructure to deal with the homeless population, but they did build on that. So for example, as you can see there, they added a tent city, which ended up housing over 500 families of immigrants. And they also collaborated with hotels in the area to be able to house more immigrants in the hotels. And while some of the contractors previously mentioned when it came to housing were problematic, collaboration with other NGOs that were more focused on volunteering were found to be really helpful. So organizations like Women in Need, Volunteers of America, and Help USA really helped the integration go more smoothly and provide services to these immigrants in the New York housing. And then also New York had a program called the CPF program, and it's essentially a rent subsidizing program where for up to 5 years, New York will help pay for some of the portion of the rent when someone is transitioning from a homeless shelter to permanent housing. It is noteworthy though, as I mentioned earlier, that not many of the immigrants were able to transition to permanent housing. So although this program exists and could be really helpful, I think there is something to be said about the lack of information that the immigrants are able to get on it, or just like the difficulty with the legal side to actually get access to programs like these. That would be really helpful for them. And now I'll move on to the education pillar. And again, I just wanted to give some background on that. So most of the immigrants that have come in to New York came in with a very limited education background. In fact, like 70% weren't even completing high school. And language-wise, the majority of them lacked more than elementary level of English proficiencies. The good thing is that most of the families were able to enroll their children in school. However, only 22% of the immigrants were able to access English learning classes. But despite that, New York does run over 900 comprehensive after-school programs and did have programs at the public libraries as well as another way for these immigrants to access education. And now moving on to areas of weakness, I didn't find a lot of areas of weakness with education. The main one was really just limited information on how to actually access these programs. So as you can see here on their website, New York lists a bunch of different ones like Compass, NYC, Beacon Community Centers, and all of that, which is really great that they have all these different options. And then under each one, they'll have like a blurb. But then if you click, say, like learn more, it just gives you more information about what the program is, but it's very wordy and it doesn't give anything like where they take place or how to enroll in them. And also all this information is really only available in English, which creates a further barrier to access. But areas of strength, they did have a lot. So the primary one that I found was just a lot of diversity in the type of programming. So this map shows all of the different after-school programs in Brooklyn, and they actually have some across all 5 boroughs, and then also available to all ages. So there were some for elementary, middle, and high school students, but also for adults. And they varied in the type of programming that they're offered. So some were more recreation focused, some were more like homework help, some were focused on literacy. So it gave a really comprehensive way for people to get the different types of education services that they needed. And then also they offered a good amount of flexibility for parents' schedules because almost all the programs ran 3 hours a day, 5 days a week, which is really substantial. And even the Beacon Community Centers, which I previously mentioned, actually ran including on weekends and holidays. And moreover, the library programs also added more flexibility because they had programs for babies and toddlers as well. So the after-school programs only ran for kids 5 and up. So the babies and toddlers option for the libraries gives immigrant parents another avenue for where to have their kids spend their time while they're looking for work or trying to do other things. And these programs also run at different times than the usual after-school programs, which again adds more flexibility with the parents' schedules. And then unlike the information online for the after-school programs, the ones for the libraries were actually really accessible, which was definitely a plus. So as you can see here, they had an events page where you can search up what you need from location to age and all of that, and then you get all the different events that are going on for a certain day, and it gives you great information about where it is and what time and what the event will consist of and who it's for. Again, this is primarily in English, so another way to develop that access is to have it be available in not just English, but the information is much less wordy and much more clear, which is really nice. And now I'll pass it on to Alexa, who will be talking about the forced pillars in Chicago. Oh, sorry.
Okay, sorry about that. So again, I'm Alexa. I covered Chicago. I'm going to be covering all 4 pillars, but I want to start out with a quick overview about the numbers again. So Chicago received over 23,000 migrants in total between August 2022 and November 2023. This is kind of the just overall period of Project Lone Star again, but only about 16,000 of these migrants during that time period were expected to be directly from Project Lone Star. So Chicago already was receiving a lot of migrants, but obviously this is a pretty large increase in numbers, so that really just pushed their resources to the limits. So I'm just going to go over what Chicago tried to do to kind of supplement this large increase. So first of all, talking about housing, first with the areas of weakness. Okay, sorry, back to the areas of weakness. So Chicago's #1 problem was weather incompatibility. Similar to New York, they created these very large tent cities. They could host about 1,400 people each, but Chicago, as you probably know, has extremely harsh winters, and they really just couldn't sustain the tent cities humanely. And then similar to Acacia in New York, Chicago contracted with Garda which was also known to build immigrant detention centers. This just raised a lot of public concern for the conditions in these shelters that were supposed to help these migrants. And then isolation. So Chicago started out by having very accessible shelters for incoming migrants that were very easy for volunteer communities to access and help with medical needs, food needs, like things like that. But as this large influx happened, they started to move shelters to places like bus centers and police stations, which were, for one, inaccessible, but for two, specifically with the police stations, led to some altercations just because of the climate of what was happening. And these altercations that happened between migrants and police were known to jeopardize migrants' ability to gain their status eventually. And then similar to New York, this was a problem across all of the cities. Short stay times in shelters due to overcapacity led to migrants becoming homeless and unable to really get on their feet. And that coincides with the work authorization, which I'll touch on again in a bit. And then for areas of strength in terms of housing, like I mentioned, the tent cities could house up to 1,400 migrants, so they were very sustainable during the spring, summer, and even fall seasons. It's just the winter that these really couldn't keep up. And then Chicago shelters uniquely provided childcare and transportation to and from necessary appointments. And of course, incoming migrants have a lot of medical needs. I'll touch on healthcare in a little bit more specifically, but the shelters did provide transportation to and from the appointments. So moving on to education. So in terms of weaknesses, it was such a large influx of people that migrants in these shelters were being sent to schools outside of the districts for those shelters. So it was really hard for Chicago to compensate for that in terms of bus routes. It was really hard to get people from one shelter on the south side all the way to the west side. And then in addition, there was just insufficient language and trauma support. It was just very difficult to keep up with such a large influx all across the schools. Previously, things were pretty centered at schools on the south side, I believe it was. But then in terms of strength, they did have a community support center, which was located at San Clemente High School on the west side. This provided families with trauma assessments, meals, and they even conducted English proficiency tests and provided resources for the families. So this was a very great center, but as I mentioned, it was on the west side. It was kind of hard to access, and in addition, you did need to make appointments online, which did create a barrier for a lot of funding. But the city did, in the 2023 to 2024 school year, really increase funding for bilingual education. So that was obviously really good, but it was kind of the situation where people were affected by so much trauma, and there was such a big need for more language support that even this very, very large amount of funding couldn't supplement that. And then moving on to work information. So again, similar to every city, you're going to hear lengthy wait times combined with short shelter stays led to people, for example, working undocumented, which jeopardized their possibility to gain status as well. And it was just kind of a ripple effect of problems between long waits for work authorization and short stay times in shelters. And then for areas of strength in terms of work authorization, New York had the opposite problem, but Chicago specifically did have a lot of support and help from the state. Governor Pritzker was very supportive in pushing for policy changes at the federal level. This included Asylum Seeker Work Authorization Act of 2023, which didn't pass, but it would have shortened the wait times if it did. So that dynamic between the city and the state really did help Chicago a lot. And then moving on to healthcare. So areas of weakness for healthcare were for adult healthcare specifically. Adults were able to access only the baseline public health departments resources. And then, as I mentioned before, especially for those isolated shelters, they only really had two options, which were a basic first aid kit or calling an ambulance, which of course is extremely expensive. And then in terms of strengths, the children, migrant children, were able to gain very, very comprehensive health care through partnership with Lurie Children's Hospital, and this health care included mental health. So for adults, mental health care was less accessible, but for children, it was a lot more accessible, which is at least one step in the right direction. And then similar to New York, I'm not going to repeat all of the details there, but they had basically the same identification system for all Chicago residents, regardless of their immigration status. And yeah, that's it for Chicago. I'm going to hand it over to you.
Right. Oh my god. Hi guys, I'm Vithra, and I'm going to be touching on all four pillars about Denver. So just to give some background, Denver received a little under 20,000 migrants from Operation Lone Star, and what made Denver unique is that a lot of those people did not stay in Denver. So because it was kind of a centralized hub and it had a highway directly up from Texas, it kind of started as a hub for people to go to other cities like Chicago, like LA. I think LA experienced this during Operation Lone Star. So about 1/3 of the migrants that Denver received did not stay in Denver and were instead bused or flown to other cities. This caused a lot of controversy because the other cities did not know these people were coming. They weren't really given prior notice or the ability to say yes or no. So this caused a lot of conflict between sanctuary cities. I talked to a lot of Denver officials who kind of said that people wanted to be bused to other places. They were kind of just following what people wanted to do. So that's kind of their justification for it, but just something that adds a little bit of background to how Denver handled this. So as you can see, the number of travel tickets purchased for migrants skyrocketed due to Operation Lone Star. Right, I'm going to start with healthcare. So in terms of weaknesses for healthcare, there were two big ones. The first one was upon arrival, there was no healthcare intake system that allowed people to be aware of healthcare needs right up front. I talked to somebody at the Office of Asylum in Denver who basically said that if she could go back in time, they would have a centralized healthcare intake system that allowed them to know about disabilities and medical needs up front rather than waiting for people to be dispersed to shelter before figuring that stuff out. So that was kind of an area of weakness. Another area of weakness was that a lot of migrants were scared to utilize the healthcare offered to them, even though Denver did offer healthcare regardless of immigration status, just because they worried about their immigration status getting exposed during healthcare visits. Although Denver is very clear on all of their websites that they don't check immigration status, a way to fix this could have been with a centralized approach that had people kind of sign up for healthcare right up front that explained very clearly to them that they were not going to have their immigration status be checked. But Denver did a lot of things well in terms of healthcare. So the first was Health First Colorado, which is a their version of Medicaid, and that was available to people under a certain income and to pregnant people and children. This was pretty comprehensive health care for that group of people, and for people who didn't qualify for that, Denver had a really interesting program called OmniSalute. This was basically an online platform that allowed migrants to compare different healthcare rates and understand what their best options were, and no OmniSalute program checked healthcare. So Colorado has this law in effect that any healthcare provider has to offer lower cost options that are available to everybody regardless of immigration status. This was an overwhelmingly successful program. I think 11,000 people enrolled for it in the first 2 days, and the feedback was very positive. So that was a good thing that Denver did that LA could adopt in the future. Moving to housing, this was probably the area that Denver handled the worst. The biggest problem with this was the 4-week stay limit in hotels. So Denver did have partnerships with hotels that housed mostly migrant families, but 4-week limit really didn't allow people a lot of time to get on their feet and find jobs, especially in light of the federal restrictions on work permits. So that was a huge problem because after the 4 weeks ended, people ended up just kind of going into encampments, being mixed in with the local homeless population, and that made it very difficult to keep track of people, to make sure their needs were being met, and because Denver, like Chicago and like New York, has a very harsh winter, that kind of made it a problem for making sure that people were staying in housing. But a big part of this was that there were length of stay issues with the federal government. So the federal government placed limits on kind of who could stay where for how long based on immigration status, so Denver was kind of battling that. I also spoke to a lot of people who said there were issues with kind of the city level versus the state level not being super cooperative, so that was kind of another background to that. Another issue that Denver kind of faced was the controversy over how migrants are being treated versus the existing homeless population. So there was a lot of sentiment, especially towards the end of Operation Lone Star, that Denver was providing these shelters to migrants while neglecting their local homeless population. This led to a lot of new shelters that were in the process of being developed being stopped because there was a lot of controversy and City Hall ended up pulling the contracts. But in terms of areas of strengths, the footprint of faith-based organizations in Denver was very strong. So local churches and synagogues stepped up to act as shelters, and this proved to be very successful overall. And the contracts with hotels, even though they were short-term, allowed families to stay together, so there was no family separation, and that kind of was a pretty positive system. So we can see that Denver did house a good amount of migrants per day, but this is nowhere near the capacity they needed to be able to house everybody that was arriving in the city. All right, moving to education, there were two big areas of weakness. The first was a lack of language access programs. So many people were coming into Denver with very limited English, but there was a lack of ability for them to access resources in Spanish or whatever language they were speaking, and there was very little cultural integration resources available to them. Also, another area of weakness was that there was a lack of formal preschool programs. So once kids were 5 and were elementary school eligible, they could enroll in the local elementary schools. But for kids who were a little bit younger, parents kind of didn't know what to do, where to keep their kids while they were out looking for work or doing other things. And we can see that the test scores for children who are children of migrants were significantly lower than children who are non-migratory. This isn't surprising given that they're dealing with a lot of trauma and other things and are in a new environment, but it does show that the school system was kind of inadequate at integrating them fully. But in terms of areas of strengths, schools kind of served as this kind of multi-purpose community hub. So they hosted food banks, they hosted kind of ESL lessons, they hosted Know Your Rights trainings, and it kind of became this area for parents to get all of their resources, not just limited to education for their children. Also, Know Your Rights trainings were dispersed through school websites, so that was another way that parents could know what to do if they got detained while their kid was in school, or what to do, how to update their emergency contact, things like that. Notably, that website is only available in English. That is a huge area of weakness that would have been better if it had been available in multiple languages. This is something I've highlighted. It's a comprehensive needs assessment for migrant youth that the Colorado Department of Education did. It's a pretty hefty document, specifically focuses on migrant youth and kind of how to best suit their needs. So this is a really important document that Colorado has been updating every year that I think is really important to making sure that their needs are met in the future. All right, and then the last pillar is employment, which Denver probably handled the best. The areas of weakness for this one were, as we said with other cities, the lack of work permits, but that's a federal issue, but also the lack of response from many job training organizations and nonprofits. So while job integration nonprofits did exist in the city and they were kind of listed on city websites, I personally had a lot of hardship getting them to respond to my emails, getting them to respond to phone calls. A lot of them reported understaffing issues, so I imagine that migrants were facing very similar problems. Also, there was kind of a lack of language access programs and cultural workplace integration programs as well. So for the migrants who did find jobs or came in with existing work authorization, they kind of were faced with this very new culture that they had not experienced and a lack of training to integrate into that. And finally, for the areas of strength, the Denver Immigrant Services Legal Fund was set up as part of Operation Lone Star, and this basically funded eligible nonprofits who were providing legal services to migrants. It's a fund that was run by the city, but it also accepted private donations, and it was pretty hefty at providing a lot of migrants with the resources they needed to help find jobs. In addition, there were two kind of Denver city programs that were very helpful. First was the Denver Asylum Seekers Program, which kind of helped people obtain work authorization, and the Denver Economic Development and Opportunity Office connected people with jobs once they had obtained their work authorization. And these two programs were very successful at kind of helping migrants with work authorization. And the last thing I wanted to highlight is the Denver Newcomers Playbook. This kind of goes across all 4 pillars, but it's a comprehensive guide to how to get rental assistance, what nonprofits should do to best integrate migrants. And I thought this was a really important resource for migrants to have. It was available in English and Spanish, and essentially just offered like a comprehensive guide to how to get integrated into the city that migrants and nonprofit partners can access. All right, now I'm going to hand it over to Shiza to talk about LA.
So last but not least, I'll be going over the best city of Los Angeles, specifically the housing and employment. Okay, so to go over some relevant background information, overall Los Angeles was able to manage the migrant bus arrivals relatively better compared to other cities. This can be attributed to several key factors, most notably the city's humane and compassionate approach toward welcoming the migrants. Unlike cities like New York, which sounded alarms, faced extreme shelter shortages, and had to seek federal emergency assistance, Los Angeles collaborated closely with nonprofits and faith-based organizations to provide migrants with the resources they needed. LA also had the infrastructure and networks in place to support the migrants because the number of individuals that came during Operation Lone Star was only a small subset of the usual population that comes on a monthly basis. So after speaking to some of these organizations, I found that the process went relatively smoothly. So all the buses arrived at Union Station. From there, they were given food and snacks and then disembarked and were given assistance by the LA Welcomes Collective. So the LA Welcomes Collective is a coalition of 7 organizations: Sherla, Clue, IMDEF, Harrison, Esperanza Immigrants' Rights Project, Archdiocese of LA, and the Haitian Bridge Alliance. And together they were able to provide food, shelter, health assessments, mental health care, family reunification to over 1,400 migrants. So they mostly relied on donations that the churches already had, but there are also a $1.3 million contract with the LA Welcomes Collective, according to Cal Matters, which helped them tremendously. Overall, LA had more of a centralized strategy compared to other cities like New York. So New York had more of a fragmented approach in terms of contracting with multiple agencies. LA mostly just worked with the LA Welcomes Collective, which worked with a number of migrants they were helping. So I was able to compile data on the first 22 buses that arrived to Los Angeles, and I linked that data to the spreadsheet on this slide. But to summarize the key findings, I found that the migrants came from June 14th to October 4th, and there were days when multiple migrants arrived at once, and this is towards the end of Operation Lone Star. So largest arrival was 109 people, and that's when resources were sort of overstructured. I'll get into in the later slides. About 1/3 of them were children, which is a lot. And then among the national origin, I found that the most frequent group were Venezuelans, and there were some buses that were almost entirely Venezuelan. And this is significant because they're not a historically common group to migrate to LA. In terms of housing, LA had a relatively successful strategy toward housing migrants, but after speaking to organizations, they suggested a few strategies to improve LA's response in the future. So first, they expressed that there was inadequate church infrastructure, so lack of effective beds, bathrooms, kitchens, and this was especially apparent on days when multiple migrants arrived at once or one day apart. And this is also when you saw resource strain, so migrants did not receive enough resources they needed. Also, some groups had it easier than others. For instance, Venezuelans and Colombians struggled a lot because they did not have a community in LA they could lean back on, and so they tended to stay in temporary housing for over a month versus other groups like Central Americans stay for 2 to 3 weeks. And then a lot of faith-based organizations expressed that there were unclear rules regarding property expansion plans. So during this time, churches wanted to expand property to house migrants and build affordable housing, but they didn't know how to go about doing this, specifically using the Affordable Faith-Based Lands Act. And now I'll be moving on to areas of strength. So the churches were able to provide temporary housing to all the migrants that arrived. After speaking to CLUE, they're unaware of anyone that actually had to go homeless among the people that they helped. So 65% of migrants actually ended up leaving LA to neighboring cities or states, but the LA Welcomes Collective ensured that no matter where they went, they had a place to stay. And this is supported by the data that reveals that there are no homeless shelter spikes during this period. So now moving on to employment, in terms of areas of weakness, like everyone has said, the work permit waits are really long for asylum seekers. Some of the organizations in the LA Welcomes Collective, however, indicated that they wish that there was more advocacy on the LA side regarding expediting this process, so pressuring the Biden administration to take more action on this problem. Lastly, on areas of strength, fortunately, most of the migrants that arrived were actually on parole status, so they were able to work before their court hearing. And then there's also a really good program by Carson called the Day Labor Center. This is funded by LA, and they're able to connect migrants to employers around Los Angeles. So they serve over 1,000 migrants on a monthly basis. And lastly, even though the process to apply for a work permit was very complicated, the LA Welcomes Collective was able to help them with paperwork, file for work permits, etc. So now I will be transitioning it over to Isai, who will talk about the last component of this presentation.
Yeah, for sure. So I'm specifically going to focus on healthcare and education, and then lastly we'll pick our recommendations for what we think Los Angeles should do in an event where there's just a larger amount of migrants to come. So beginning with healthcare, it's also important to preface that because Los Angeles received like the least amount from Operation Lone Star, like less than 1,500, the scope and extent to which we can analyze this group population isn't like the best. So some of this information is going to reference like general immigration population in Los Angeles. So areas of weakness, there's like typically an underutilization due to fear and misinformation. So migrants when they come to the United States, they typically don't have like the same confidence and trust in these medical institutions because they believe that they're going to report to immigration services or they're going to report them to like, just agencies that will either like deport them or just incarcerate them. And because of that, it's also important to know that like a study released by the Public Policy Institute of California found that undocumented immigrants, even when provided with insurance or the ability to like access healthcare coverage, typically they're the least likely group to like seek access to preventative care. So following up with appointments, looking for like a diagnosis, following up with therapy. So the group already alluded to it in terms of like mental health, but in other services where migrants have chronic conditions, they're least likely to approach these different medical institutions. Beyond that, there are financial and logistical barriers, so such as high cost of living, transportation. In Los Angeles, this is like kind of a big issue just because a lot of like the medical centers are located like in different parts. There's parts in like UCLA, there's others in MLK, like near Compton. But a lot of them are kind of just like geographically isolated. Beyond that, there's also language and cultural hurdles. So obviously, like there's the dominant language of Spanish, which is like a very prevalent across Latin America. But additionally, there are certain groups such as like indigenous communities that typically don't have the same, ability to kind of access these different health services just due to like the language that they speak. And this is like specifically prevalent to them because typically when they come to the United States, they don't only learn English here, but they also learn Spanish here. So making this accessible to different groups would also be approachable. As for like other weaknesses in healthcare, and specific to Operation Lone Star, is it was hard to track like the registry, like the amount of migrants who came from these buses who immediately registered. Whether that's a weakness or positive, just given LA's non-transparent policy, that's something that was like hard to track. So yeah, and now we get to areas of strength. So luckily, when migrants arrived at Union Station from Operation Lone Star, there was an immediate health assessment, so they were checked on their physical well-being. They were also checked, like multiple agencies have reported that they were assessed for COVID or other potential diseases such as the cold. Beyond that, in terms of the grand scheme, in terms of Los Angeles in general, Los Angeles is fortunate enough to have a very easy referral for federal and state programs that makes the process of applying to healthcare a lot more streamlined and more efficient compared to other states and cities. And this is especially relevant here because that's something that Los Angeles just has a really good foot in door in. But beyond that, Los Angeles also recently expanded their healthcare coverage. So prior to 2024, there were about 1.6 million undocumented immigrants who were under healthcare coverage, but due to Governor Newsom's recent expansion, there was an additional 700,000 undocumented immigrants who were able to access healthcare in 2024. But before that, I held Los Angeles from 2014 to 2024 had about 147,000 undocumented immigrants who they were assessing independently. But additionally, even if undocumented immigrants don't have the fortunate circumstances to get covered through healthcare coverage, whether that be through Medicare or Medicaid. Los Angeles is fortunate to have a strong community health infrastructure, so there are a lot of community centers that kind of equip themselves towards helping these different populations, and a lot of these are federally funded, so such as the Humane community clinic, which makes itself visible in different areas of Los Angeles, specifically in South Central. Additionally, there's also community buses or mobile clinics that are very accessible for folks of undocumented status. Now, when we reach the education standpoint, it's important to mention that there are a few areas of weaknesses. So typically, when undocumented children come to Los Angeles, they're enrolled into school and are sometimes placed into English language development programs or ESL programs, as prior reference. But typically, one of the things that we found from our research was that these ELD programs can at times be insufficient and inefficient in themselves, in the extent where they encompass a one-size-fits-all approach. So typically, they put students who are learning English or who don't speak any English at all with kids with special needs, and that can be a problem for two reasons. One, it kind of hurts kids with special needs. It's ability to have accessibility to their professional trained teacher. But second, it also limits their ability to learn and further maximize their opportunity in education. So kind of resolving these one-size-fits-all approaches is necessary. So one way that we've outlined that is encompassing more staff, bilingual staff, trauma-informed staff, and making sure that these different programs are accessible. In the context of Operation Lone Star, it was also hard to track the amount of children who themselves enrolled into education. So just a lot of its analysis is just based off of Los Angeles and its migration population in general. But beyond that, one of the key weaknesses that we found is the impact of immigration enforcement. So most recently, the optics have been very visible in the sense where there have been ICE agents going to schools, conducting either raids or trying to get into institutions. And typically, the impact of immigration enforcement, though many people don't think it's a big issue because they're never deported, it becomes a real trauma-inducing moment for many of these students. So, a study from UCLA found that about 14% of children from the ages of 7 to 14 were more likely to repeat a grade as a result of constant enforcement, whether that be the police or fear of immigration. And about 18% found that 18% of 14 to 18-year-olds in LAUC programs are more likely to drop out of school just as a result of these trauma-induced movements. Additionally, there's some resource limitations in education, so a lot of the lack of access to bilingual staff and services and care towards trauma-informed incidents. Now, in areas of strength, luckily there at least exists an established institution in the English language development programs, so ELD programs. Los Angeles is fortunate to at least have some form of streamlining this process. There's also strong establishment in the network of extracurricular institutions, so having reached out to multiple LAUSD schools, specifically in the South and Southeast area of Los Angeles, they were able to tell us about the effects that Beyond the Bell has, or the effect in which other nonprofit institutions have been able to exhibit, whether that be through their partnerships through local universities or other nonprofits like the Los Angeles Metropolitan Daily, for example. Beyond that, education, typically when it comes to the enrollment process, it's very simple for these students. Typically, it doesn't require a very excessive demand of documented status. I will say that another important aspect that we've outlined in terms of weaknesses is that when students get enrolled into English language development programs, usually they have to fill out like a survey or like a paper, and typically it asks the question of like, what's the most common like language spoken in the household, and usually that's how they determine the placement of students into ELD programs. And now we're going to get into our policy recommendations. So specific to housing, as outlined by like a lot of my peers, something that was like very prevalent in many of these communities and was successful, and we think that can be cross-applicable to Los Angeles, is the partnerships, whether that be through hotels, local hotels, or faith-based organizations. So the faith-based organizations in particular stepped up in terms of like providing housing, providing access to resources that otherwise would have been inaccessible. But they found a few problems. So the first was infrastructure investment. Typically, a lot of these faith-based organizations don't have the same, they don't have the same investments from like from like the city or from folks or from companies in general to provide housing. Additionally, they also have to come into this barrier of getting permits towards building these different infrastructures. So Los Angeles being able to streamline permits would be a very big plus in terms of an event like Operation Lone Star would happen again. Beyond that, we think that working with existing Los Angeles programs and providing additional support would specifically be very beneficial. Having spoken to a lot of folks from the Los Angeles Homeless Service Authority, they talk a lot about the lack of outreach staff and the lack of making sure that a lot of this information is publicly accessible. They spoke about underfunding, and I think that in an event where institutions like Last Hour are providing very important work, additional aid does need to get provided. Additionally, we think that contract vetting is something that should be approached. So obviously vetting with these different contractors who at times don't have the same ethical or don't have the same ethical commitment towards making sure that immigrants find accessibility to housing. In terms of employment, we think that legal aid and pro bono services would be particularly beneficial. So providing some extent of joint work permit advocacy coalition in Los Angeles would especially be helpful because as outlined by my peers prior, typically migrants when they come to Los Angeles, they engage in either informalized economies, which typically requires them to be street vendors or work in jobs that are just you make $100 a day and we'll pay you, or $80 a day. So one thing that we found was providing some form of advocacy with the Joint Work Permit Advocacy Coalition would allow us to streamline and kind of introduce migrants into the formalized sector of the economy as a way to protect them, but also as a way to grant them job accessibility. Beyond that, we think that there should also be an improvement of accessibility for legal forms, so making sure that migrants kind of are understanding of the job requirements that are required, those requirements that are necessary to fill out the job application. Additionally, it's important to support mutual aid, community-based employment networks, and nonprofits, all of which across Los Angeles, such as here the Centers for Workers' Rights, Asian Americans Advancing Justice, CRLA, the Legal Aid Foundation of Los Angeles. They have all kind of joined the coalition to it's essentially provide forms of employment towards undocumented immigrants. In terms of healthcare, we think that there should also be a multilingual access and navigation support. So typically, undocumented immigrants don't have any idea about what is required in filling out these forms, and sometimes they don't have the necessary information, such as an ID. So being able to provide some form of navigation support or a streamlined center that can essentially help and guide migrants would be especially beneficial. We think that there should also be an insurance enrollment and affordability program. So in the event where a lot of these migrants aren't able to get covered by Medi-Cal or Medicaid, they can either access federally funded healthcare programs in Los Angeles or find ways to make sure that they are very consistent with their treatments. Additionally, we think there should also be a standardized intake form at arrival sites. So in the event where there's a mass deportation, on a scale of Operation Lone Star, there should be a standard intake form of to assess the quality care and the health conditions that many of these migrants have. Additionally, community outreach is a very important thing that we want to outline. So whether that be through mobile clinics or community centers, making sure that a lot of the information is accessible towards immigrants would be very beneficial because typically undocumented immigrants don't really know about these programs. So making sure that they're aware and eligible for these programs would grant visibility, but also accessibility to healthcare. In terms of education, this is the last point. We think it's important to expand bilingual and trauma-informed support in schools, whether that be through the hiring of staff, providing even more programs, or centralizing the process within different sectors in Los Angeles. So like an example could be like Southeast LA. We also think that it would be important to like improve after-school program accessibility and variety. So provide more than just students, because a lot of like the teachers that we talk to in South and Southeast LA kind of spoke about the after-school programs either just like letting students just be there and not like really teaching them anything, or just kind of like improve their education quality. We also think that it's important to strengthen community partnerships and resource hubs to ensure that a lot of like education is like streamlined, but beyond that, it's accessible to all migrants. Additionally, like something that can be taken away from like other areas is the improvement of transportation access. Los Angeles exists like in an unfortunate circumstance where we have a lot of traffic, obviously, but providing things like tap cards towards students would be something very, very, very beneficial. I know that the LA Metro system already has like a program where it's $1 for students, which is like a substantial discount, but we think that there could be more done to that. We also think that there should be like an improvement in terms of data collection and monitoring to ensure that undocumented immigrants are getting the support that they receive in terms of education, but also in healthcare. And I did want to like provide like this kind of graphic because it kind of shows like the 3 dimensions into which education is approached in relation to undocumented immigrants. So, or in terms of like English language development or just other language. Typically, there's a world language immersion program which is like designed for English speakers. Los Angeles like doesn't really have this, or it does through means of like AP education systems. But there's also dual language two-way immersion programs, which this program is designed for English learners and Spanish speakers. And lastly, there's a dual language one-way immersion program, which is this program is designed for English learners. Typically, like this, you see like this little line in this umbrella. The lines tend to get blurred as it relates to accessibility towards undocumented immigrants in relation to children. So making sure that these students aren't fit into a one-size-fits-all approach would be something that would be very beneficial and we think is applicable towards undocumented children in Los Angeles. So that's yeah.